Hello, my name is Brent McBride. I'm a professor of human development at the University of Illinois at Urbana-Champaign. And I'm also the director of the Child Development Laboratory on our campus. I've spent 32 plus years in the world of early childhood, working as a classroom teacher, program administrator, and also working as an educator, working with pre-service and in-service teachers. Today I'm going to be talking to you a little bit about the child care context as it relates to childhood obesity. Over the course of this class that you're enrolled in, you've been learning about all the multiple determinants of childhood obesity, everything from a cell level all the way out to the societal level. Today we're going to talk about a community level context that plays a big part in influencing childhood obesity, that being child care settings. Now, why am I worried about child care settings as a determinant of childhood obesity? We know that a great proportion of children in our country spend a majority of their waking time in child care settings or non-parental care settings. We know back in most recent statistics from 2012, there were more than 12.5 million children spending their waking hours in child care settings in our country. Because they're spending this time in child care settings, food consumption and physical activity become a really important issue. And it's a reason for concern as we think about what are the determinants of childhood obesity. Now, we know when children are spending 30 hours plus per week in a child care setting, they're consuming anywhere from 1/2 to 3/4 of their daily calorie intake in such settings. And they're consuming these meals at a very critical time in their own development. We know the preschool years are critical in terms of children developing food preferences. We know that preschool time is critical as children develop nutritional patterns in their intake and so on. We also know that as children transition as young babies off onto solids and table foods, it's an important time for children to be able to maintain the ability to self-regulate calorie intake. And if they're in child care settings as they're going through this process, we should be concerned about what role those settings are playing in that process. Now, as we think about child care settings and its impact on obesity with young children, the people who are in these settings working with the children play a very important role. Child care providers are a key determinant of what happens in those settings for young children. Now, when we think about child care settings, multiple meals are being consumed in these settings. One of the things that we're concerned about as educators is the fact that there are no federal regulations or guidelines that tell us what child care providers should be doing when they're serving food for children. So when these child care providers are serving breakfast for the children, a morning snack, a lunchtime meal, and an afternoon snack, there are minimal guidelines that they have to follow to ensure that they're having healthy and nutritious meals and being served in an appropriate way. We know that the providers who work with these children in child care settings oftentimes are poor nutritional models themselves. The majority of child care providers in our country tend to have poor nutritional habits for their own selves. They are not good role models in terms of their own weight status. Many of them are overweight and obese. And we also know that they're poor nutritional models for the children in terms of food preferences and the kinds of foods that they're consuming. We also know that as we think about the child care setting and how it impacts children's nutritional intake and food preferences, there's been very little empirical research that examines that relationship between the two. Now, the same reasons, the same kind of concerns that we have about the child care setting in terms of food consumption also applies to physical activity. We know that there's this perception that child care settings are a beehive of activity. In fact, in the background, you may be able to see the children on the playground running around. So there is this perception that children, when they're in child care settings, they're constantly moving and so on. But the reality is, in our country, child care settings are not beehives of activity. In fact, children spend a lot of time in their sedentary activities. And unfortunately, in some settings, child care programs are also having children spend a lot of time in front of a screen, TVs, looking at videos and television shows. So again, not a good model for physical activity to help reduce the trends towards childhood obesity. As we think about the role that child care plays in impacting children's nutritional and health status and weight status, one of the things that we know is that the policies which guide food intake in child care settings are really critical. As it stands right now, again, there are very few regulations that apply to child care settings in terms of the kinds of food service they have, the feeding practices that they have with their children as well. There are some guidelines from the U.S. Department of Agriculture for child care programs that participate in the child and adult care food programs, but those guidelines may basically relate to the kinds of foods that are being served to children and the portion sizes that are being fed to children. It doesn't have anything to do with the feeding styles and feeding practices in such settings. We do see a shift, though, in this policy emphasis. Policymakers at a state and national level are beginning to acknowledge that the child care context can be an important factor in helping to reduce the rates of childhood obesity in our country. As programs work on improving the quality of their programs, health and nutrition-related behaviors are becoming part of that conversation. When we look in our country about the policy standards that guide practices in child care programs, you can think of it along a continuum. Everything from minimal policies and guidelines to very heavily policy or regulated types of programs. On one end of this continuum, we consider Head Start to be the gold standard for what policies can do in terms of guiding effective practices for health and nutrition-related behaviors. Head Start programs serve children from economically disadvantaged backgrounds, but the teachers working in Head Start programs work under Head Start performance standards, which outline pretty much everything they do within their programming, everything from the curriculum, the teaching strategies they use, the physical environment that they have the children in. But they also have guidelines on food, nutrition, and physical activity in their programs. So that's one extreme of the continuum. At the other extreme of the continuum would be programs that don't participate and receive any monies from the federal government, like subsidized child care vouchers or the child and adult care food program from USDA. So basically they're working just under their local licensing guidelines from the state in which they're participating in. And somewhere in between you have programs that do have some support from the federal government. They're either receiving child care subsidy vouchers to support children from low-income homes, or they're receiving funds from the child and adult care food program. So there are some policies and guidelines related to health and nutrition that they have to follow. Now, when we look at these three different extremes on the context for policies, we know that the feeding practices that take place in Head Start programs, we know that the teaching strategies related to health and nutrition in Head Start programs, and the way they communicate and work with families about health and nutrition related issues far outshine those of what you see in center-based programs that don't have these Head Start policy guidelines. So the question is, why is Head Start able to meet what we consider to be the gold standard in terms of health and nutrition related practices and the other programs can't? A couple years ago, the federal government has started to acknowledge that they need to put some more guidelines in place for these programs to follow to help improve the nutritional practices and the physical activity in child care settings. And some new policies are coming down the pipeline to help spur this along. So as we think about that, we're asking quality rating improvement systems that are being rolled out in different states in the country, as well as in local licensing standards, to start incorporating criteria that actually relate to health, nutrition, and physical activity. And as these quality rating systems start incorporating these standards related to health, nutrition, and physical activity, we hope to see changes in the practices being exhibited. But as these programs start following these guidelines and becoming better educated about what they should be doing on health and nutrition related activities, I would speak a word of caution though, because one of the things that I like to talk about anytime we suggest that child care programs need to be doing something different is I like to think about the daycare trilemma. So if you think about daycare as 3 points on a triangle, one of those points would be the quality of the program itself. So how well trained are the teachers, what kind of materials and equipment are they using appropriate curriculum, and so on. That's the quality point on the triangle. The second point on the triangle I consider to be accessibility. How accessible are these programs to the families that are enrolling their children? And by accessibility, I mean how affordable are they to the programs? And then the third point on that triangle I call compensation. How are we paying the teachers working in these programs? Child care providers tend to be underpaid. They tend to have low wages. They tend to have minimal, if any, benefits and so on. And that's a very important part on that daycare trilemma, that triangle. So if you think about trying to address any one of those 3 points on that daycare trilemma triangle, you have to go cautiously. So if you believe that you want to put resources into improving the nutritional aspects of the programming, so you're providing fresh fruits and vegetables, higher levels of training for the teachers in terms of their knowledge base on nutrition and health status, physical activity, that's going to create an imbalance in the triangle so that other parts will have to be slighted. For example, you'll have to either charge families more to be able to have access to the program, or you'll have to cut staff, their compensation and so on, to be able to afford to increase the knowledge base and those resources.